What are indications or uses of stem cell therapy? In orthopedics, that is basically in bone and joint treatment, stem cells can be used for the treatment of number 1, osteoarthritis, mainly grade 1, grade 2 and some cases of grade 3 arthritis. In osteoarthritis, there is damage to the cartilage and sometimes damage to the bone. The stem cells harvested from either the fat or from the bone marrow is injected into the joint or into the bone. These stem cells then develop into either the cartilage or the bone depending upon the site, and it can lead to healing of the arthritis or regeneration of avascular necrosis of the bone. Another treatment where the stem cells are useful is avascular necrosis of the hip joint. In avascular necrosis of the hip joint, due to lack of blood supply, the bone is dead, especially in the femur. In the head of the femur, the bone is dead because of lack of blood supply. In stem cell therapy of avascular necrosis, either there is drilling done through the bone into the head, and through the drill hole, the stem cells are injected. The second way it can be done is by just injecting through a needle into the femoral head. These injected stem cells then develop into bone and help in regeneration of the dead bone. So stem cell, mainly two indications are there: arthritis and avascular necrosis in orthopedics, that is bone and joint treatment.